You were anticipating like I was, because I've got four great folks to talk about what I love talking about, which is recruitment. We're talking about healthcare recruitment in 2021. What has changed, from the past? And then where do we see things going? Like what stuff are we doing now that's changed that we think are going to continue? Maybe some things that we don't think will continue. I would love to hear it. And I'm really excited about it. We actually have varied specialties here within healthcare, which I think is really cool. Also, geographically, we have got some variations as well. So hopefully we have a little something for everyone. We have some fun questions too. Okay, hope we're ready for that. But I'm very excited about all four of my guests. And I'm also excited about those of you who are watching. Let us know where you're signing in from, what city, what state, what country. We would love to interact with you. Please pipe in with your questions, your comments throughout our session today. And so let me just start off from the top left-hand corner, and I'm going to work my way down to the bottom. So let's start off with you, Jaime. We have Jaime Paulus from Vail Health in Vail, Colorado. Welcome to the show.
Thank you. Thank you for having me.
Yes, talent acquisition, covering lots of different clinical positions within healthcare for the hospital. And I'm going to ask you a little bit about your hospital here in just a moment. And we also have Lorraine Bamford. Welcome to the show. You're from?
Originally from England, living in Colorado for the last 28 years.
Yeah, now with Kaiser Permanente. And so we look forward to hearing you. And your specialty is a little bit different because you work in the mental health arena, which I love that. And then we also have Priyanki Amroliwala.
Priyanki Amroliwala.
Sorry, yes. Amroliwala. Sorry.
Good try. No problem. No need to apologize.
Okay, Amroliwala. Okay. So I'm very excited about having you too, because you're from the dentistry side. I know you have experience recruiting nurses, but you also have current experience within the dentistry environment. So I'm looking forward to having you in the show. So thank you for being here, Priyanki.
Thank you so much for having me, Rollis. I appreciate that.
And then we also have Miss Theresa Mazzaro. I've had Theresa on several times. Happy to have you on, President-elect of the National Association of Healthcare Recruiters. And of course, we didn't mention this earlier. Lorraine's on the board or is in the organization as well. But welcome to the show, Theresa.
Thank you so much. Happy to be here, representing a little bit of the Mid-Atlantic states, I guess, in Silver Spring, Maryland, and Bethesda right now at Suburban Hospital.
Yes, Suburban Hospital, part of the Johns Hopkins Medicine organization. So glad to have you as well. I'm just excited about all of you here. We also have Mary Fernandez Adubatu from New Orleans, Louisiana. New Orleans. I love New Orleans. That's part of my family's from New Orleans. So thank you for being here, Mary. Appreciate you. Okay. Well, you know what? Let's do this. I want to briefly hear about your different practices. Let's just do like a quick 30-second kind of thing about each of your practices that you work in, so that folks who are watching get an idea of your background. And then those who are also signing in, let us know what your background is, whether it's on the hiring manager side or the recruiting side, like what you do, or perhaps if you're looking for something, maybe let us know what you do. Who knows? We may make a connection here. So why don't you start us off, Jaime? Tell us a little bit about your organization there at Vail.
I work for Vail Health, which is a healthcare organization that services the mountain rural communities in the mountains. We're about an hour and a half west of Denver, and I've been with the organization for 14 years. I oversee talent and acquisition, and the recruiters report to me. We have close to about 1,500 employees, and we recruit for several surgery centers, a 58-bed hospital, several doctor's office and clinics. So primary focus for myself is higher level positions and clinical positions, but we recruit for the whole gamut, from housekeeping and EVS positions all the way to vice president positions.
Awesome. Okay. And how about you, Lorraine? Tell us a little bit about your organization, what you're doing there. Well, not the whole, Kaiser's pretty big, but more so what you're doing at Kaiser.
Yeah, absolutely. So Lorraine Bamford, Senior Talent Acquisition Consultant. I've been with Kaiser Permanente coming up 14 years. The service line I recruit for is for the mental health and wellness, so all licensed therapists and clinical psychologists. I actually recruit for Colorado, Northern California, and also Hawaii. So a lot of variety, a lot of different regions there. It's crazy times for everybody. I'm sure you can imagine a lot of shortages at the moment. But Kaiser is very much about the integrated healthcare, very much about preventative healthcare. We're a health insurance company and a healthcare provider, and we are very large in Northern California, Southern California, but we're also in the Northwest regions, the Mid-Atlantic regions, and as I mentioned, Colorado and Hawaii.
Very good. And I'm going to skip to Theresa because I want to ask Priyanki a question first, but our first question. But let me get your background first, Theresa, and then we'll let Priyanki go into hers.
Sure. So Suburban Hospital is one of the community hospitals. So when people think of Johns Hopkins, I think people automatically jump to the Johns Hopkins Hospital that's in Baltimore. So there's actually 6 hospitals within the Hopkins system. We're part of what they call the North Capital Region. We are a little bit unique in that we don't have any women's services here. So we took on trauma instead of women's services. So no babies are born here unless it's by accident in the emergency department, and then we get rid of them as quickly as we can. So we tend to have a higher, older demographic for our patient population. And personally, I manage the recruiting team, kind of similar to what Jaime does, but I also recruit for any manager level and above. So anything from executive chefs to right now I'm doing a director of medical staff services. And then I also recruit for my own line of service in critical care, emergency department, quality, and care coordination. So, and of course, anything else they tell me to do.
Of course. Yeah, exactly. Okay, so Priyanki, tell us quickly about your organization, but also in addition to that, I want to have a question for you right after you give us your little intro.
Okay. So yes, I am also in the Northeast. I'm, personally based 20 minutes outside of Boston. So I work for an organization called 42 North Dental. We are a growing DSO, which is called a dental support organization, for those of you guys that don't come from the dental industry. And we have about 85 practices all across New England, and we're actually growing all across the Northeast as well. So our headquarters are actually in Waltham, Massachusetts, so we're based about 20 minutes outside of Boston. But we actually have dental practices in Massachusetts, in New Hampshire, Connecticut, Maine, and New York. So we're very much of a growing organization all across the Northeast. What I'm specifically responsible for is overseeing the recruitment process for all 85 practices across New England and the Northeast. And I'm specifically responsible for helping this company grow by adding providers. So we're hiring for dentists and specialists all across these practices.
I like that. You know what I like too about what you said is that we're in charge of making them grow, because sometimes people organizations see HR as a cost center, right? And this costs us money, but you're helping the organization grow. I love that. That's what we're doing. I love that. Okay, I love that you said that.
We're definitely helping the companies grow. I feel like HR always is known to be the police of the organization or whatnot. But yes, we're obviously filling for turnover, but we're also, like, a lot of our recruiting ends up being because of growth. Yeah. So people sometimes fail to understand that.
Love it. Okay, so my first question, and I want all of us to pipe in with this. I know, Priyanki, I want you to address this first. As the pandemic starting to wind down, more people getting vaccinated, things of that nature. And as we look back, what do you think has changed the most in recruitment?
Rollis. This is, and I'm sure everyone here agrees with me as well. It's been a crazy year. It's been insane. And I feel like everyone here, feel free to chime in. This is not just a me thing. It's been an insane year at all levels. But I certainly felt it the most being a part of HR, especially being in talent acquisition and HR. We all saw, and again, please forgive me if this is not correct for your organization, but for us, we saw a huge amount of turnover. When the quarantine first happened or whatnot, at that time it was completely new to us, and we had so many of our staff members that, number one, our dental practices were shut down because we're not a hospital or whatnot. So we were completely closed down for at least a few months, and we had a few practices that were open for emergency care or for emergency patients, and the rest we were doing through telehealth.
So obviously we implemented telehealth or teledentistry extremely fast. We developed it like overnight because
Right.
it's not like anyone had a chance, had any fair warning on this. So we started implementing that very fast, but we saw huge amounts of turnover just because no one really knew what it was. Everyone was extremely scared. And you have to understand that we're working at dental practices. So if you do the research, a lot of people were really scared about dental practices because that's the place where you're walking in and your mouth is open for at least in half an hour to an hour the entire time. And you're literally dealing with a virus that comes from the human breath. So, so being part of that was a little wacky for sure. We had a lot of our staff that it's not that they actually quit their jobs or whatnot, but they really just weren't sure what the situation was. They were obviously really nervous about that. So we also had to bring in a lot of PPE, a lot of things really fast. The good thing is, I guess, all of our practices weren't open. So we had that month and a half where we actually could prepare and get everything done, for us to open back up come, I think, around May or June or July. I think we started opening right back up last June. So that was helpful. And then I think another thing is, and I'm sure everyone here can relate to this, a lot of the people that wanted to come back couldn't necessarily come back because of multiple factors. Number one was a lot of them were genuinely scared to come back just because they didn't know what that situation was going to look like. And then number two, a lot of people were really just exposed to their elderly parents or their elderly grandparents, or they might be living with them. So they weren't able to kind of commit to going back just because they felt like they'd be a huge risk factor for their loved one. So that was an issue. And then another thing was we have all these people that, have young children at home, or that even if you don't have young children, even if you had kids that were a little bit older, they're all in remote learning. So it was based on the state. It was based on the county. It was based on the town that you live in. It's not like all of the U.S. was the exact same. So some towns in Massachusetts, you were completely remote. Some towns in Massachusetts, you were going in hybrid. Some was a mix. Like it was basically madness, and I still feel like it is a little bit.
Absolutely.
But it was hard for staff members to come back because they were managing their kids at home between their schedules and stuff like that. So it got a little whacked out. Like a lot of people could come back only part-time, or some people could come back like week A, but then not week B because their kids were remote one week and kids weren't remote one week and stuff like that. So I saw a lot of spouses going back and forth, like they would rotate their work schedules. So we kind of just started adjusting all of our staff based on what schedules they had and based on what we could do for our patients.
Absolutely. So Theresa, were you seeing some of that too? I saw you kind of reacting to some of that. It sounded like some of that was familiar to you.
Well, and I was going to ask her about volumes, right? Like, are people actually returning full volume to even your patient volume? Because at our hospital, and I think across the country, that, people still have a bit of a trepidation about coming to the hospital or to the dentist because there's still this underlying fear. And now it'll be interesting to see what happens in June. I think of things operationally, right? What happens in June when hopefully everybody will be almost, everybody that wants to be is vaccinated. And then is that when they're going to go get their knee replacement? Is that when they're going to re-engage with the dentist or with the psychiatrist or psychologist? Is that when they're going to go back to the doctor? And what we're seeing is more people now that, I'll talk about staff, but from the patient perspective, our volumes dropped tremendously. So then it's like, well, what do we do with staff? And yet the volumes that picked up early on, especially last year, were all ICU type patients, right? So, it's like, well, how do you go from one ICU in a small hospital to 3 ICUs? And how do you staff that? Well, you cross-train PACU nurses that used to work in the ICU. So it was a lot of hurry up and just in time. And I feel like Suburban, I was so lucky because our leadership, I've heard horror stories about other similar healthcare providers, be it outpatient or inpatient, that the leadership kind of ran into their office or went home and started working remotely. And I felt like, wow, we've got people that are here. They're here 24/7. They're going to make it work. And honestly, I will say this, being part of Hopkins, kind of cool when they've got the cutting edge of every single piece of data around this virus. And you could still log on the website and you could see at a moment's notice live how many people have been vaccinated, how many people have this disease. And that all came from Hopkins. So I was like, yay.
That's cool.
But the same Maslow's hierarchy of needs. How do you homeschool your children? How do you take care of or not take care of your elderly patients? We had emergency department staff that, they talk about like they would shed all of their clothes as they walk through the door, throw everything into the washing machine, put it on hot heat, They were scared because in the beginning it was such unknown, right?
Yeah, absolutely.
And then we saw a transition from once we kind of figured this out and the first wave had sort of passed, it passed here. But the waves, the surges were regionalized. So we started losing nurses across the system and all across the country. There was a whole listserv topic for RACR on that today about, has anybody got any nursing candidates or has anybody got any respiratory therapy candidates or even any or mental health professionals? Because they've gone off to do these travel assignments at 5 times their pay. And now they're getting sticker shock when they're coming to talk to us about what opportunities we might have. And it's like we robbed Peter to pay Paul. Yeah. And nothing against the act, and I'm a nurse and I get it. I mean, especially if maybe my loved one was laid off because they're in the hospitality industry. Yeah. But when people tell me, when I talk to people, like, oh, I felt compelled to go to New York. I'm like, oh, did you volunteer? They're like, no. I was like, oh, okay. So you left your hospital in a state of crisis to go to another hospital and make a lot more money because you were compelled to. I mean, that's the hard part for me. It's like, why would you leave?
Yeah. So we got some folks coming in who are commenting. We have, let's see, Dr. Nina Nejma. Welcome. She says she's coming in from Jacksonville, Florida. She's an executive in healthcare who is looking for her next exciting role. Would appreciate a connection. Well, yes, connect with all of us, Dr. Nejma. We'd love to connect with you. We are connectors here. So thank you for being here. Charlene coming in saying hello. We have Joanne. Thank you. Quite a few here. Let's see. Charlene from Florida. Florida is kind of a popular state today. Okay. They have Melinda Solanke as well. All right. So let's talk about the mental health side. So from your perspective, Lorraine, did you see some similar things, different things? What changes did you see in your recruitment world in the past year?
So I would say that, at Kaiser Permanente, we were already busy in this particular service line anyway. So when the pandemic hit, it was very interesting. It was hitting at different times in different regions throughout the Kaiser organization. So what we were doing is we were looking at the different business needs, how we were changing some of those business models, how we were changing some of the, like telehealth or changing some of our practices to ensure that our patients were safe and we were still able to function normally, as normal as can be, because nobody knew what to expect. So we were watching the different regions and we were following those best practices to ensure that we could do that. With that being said, we were also ensuring, and I think Kaiser did a really good job, just to make sure that our internal employees were feeling very safe and healthy, and they had the resources that they needed. But, I was talking to some of my managers and therapists saying, I've never worked from home before, so they were going into this telehealth model. And they've never done it before. So then there were some struggles with, how am I going to be interviewing candidates? I've never done virtual interviews before, or what's the technology like? So we were sort of hand-holding those folks and getting them through the system, say it's going to be okay, we'll figure it out, sort of thing. And then we saw this huge sort of surge of, they needed more providers. It's like, where are we getting these providers from? Because even some of the candidates that were in process and going through the hiring process, they'd been offered the job, they were declining now because they're saying, I don't know what's going to happen. I'm not relocating from Colorado to Hawaii. I don't know what's happening. I'm not taking my family out there. Or they were saying, hey, I'm in, California, get me out of here. This is a hot spot. Or, I want to be back with my family now. Right. Well, now I can work remote. I don't need to be in, this sort of high price sort of area that I am. If I can work remote, I'm going to move around. So we did see a lot of internal movement as well in Kaiser, and obviously increased volume now. with the shortages, and we're really trying to, bring more candidates in. But it's just been very interesting. I don't know. We keep saying we're coming out of it. I still think as recruiters, we still feel we're in the thick of it. But yeah, it's great to network and hear what everybody else is doing so we can all learn, share, and connect with each other.
When you just said that about we feel like we're in it, I feel like that deserves this right here. Yes, we are. Yeah. We are still in it. Okay, I want to get to you. I want to get to you, Jaime, as well. But I have a question I want to ask. I want you to answer this question. Then I want you to answer the real stuff. All right, and I want folks in the comments. I want you to answer this question as well. Okay. All right. So speaking of being in this COVID thing and all that, and a lot of us working from home and all that, I'm going to give you a choice here. Would you rather, if I was to tell you you could have your total freedom here, but you have to wear a giraffe costume everywhere you went. So you have total freedom. You'd have to wear a giraffe costume, or your other option is to be confined to either any room you pick in your house. Which one would you pick? That's for you, Jaime, first.
Hey.
Okay. All right. So you will take the giraffe costume.
Send it to me. I'll take the giraffe costume and take total freedom.
I love it. Okay. In the comments, let me know. What would you take? Would you take the giraffe costume? You have to wear it everywhere, or you could pick the room of your choice in your home, but you'd be confined to that room for the entire year. Okay. So tell us.
With the mask, with the giraffe costume. Come on.
Yes, of course. We want to make sure we have proper PPE for the giraffe costume. All right. So, and I want each of you to answer in a second, but I'm gonna let Jaime answer. How did it affect you? Like, what changes hit your area in the past year?
So I feel like all of you, I feel like it's been a very crazy year. I felt very proud for how my organization handled the COVID epidemic. We were fortunate enough to not have to let anyone go. We did an amazing job, I think, cross-training people and having them all flex, and our staff was so willing. I think we created a safe environment for them. And I think then when we really needed people, when we were, stuff went back to normal, we had them on. We didn't have to do aggressive recruitment, to get the people back. So I'm fortunate for how we've done that. What initially happened is we opened up a lot of COVID clinics. So we had to scramble to, sell something that no one understood or knew about and they were scared about. So we opened up several clinics throughout the Valley, and they're still open to this day. We have, I think, 98% of our hospital employees are vaccinated, and the majority of our community is vaccinated. So for what I got to watch is everyone come together and support each other. How it changed recruitment is all virtual recruitment events. Yes. How do you keep everyone engaged and motivated when they're working remote? Yep. That has been challenging. I think that they're going to still stay home. A lot of them. The hospital created a Zen den where people can walk in and do yoga or calm down, because I think it's been really stressful. And we really grew our behavioral health because with this, a lot of people lost their jobs. A lot of people had some behavioral health things to contend with. And we grew. Colorado Mountain Medical is a physician group that we acquired during all of this, and they have grown their behavioral health providers by 40 during all of this. So I'm just really proud of our organization and how we have come out of this. I can tell you that probably the most unique thing is hiring people sight unseen. We hired vice presidents for our organization that never came and interviewed here, which I still look back and think, wow, that's crazy. In summary, that's how things have, that's what's happened for us during COVID.
A lot. Okay.
Am I allowed to ask, Jaime, did you guys have any exodus of people taking travel contracts at your hospital?
No. I think that everyone was kind of fearful. And also our location. I mean, if you're living here, you want to be here. So we didn't have that. But I can tell you that right now it's very challenging to find travelers, and that it's been definitely very competitive to get staff. So that's how we're affected right now. But no, we didn't have a lot of turnover. It was great.
That's awesome. That's awesome. You didn't have that issue. Okay. So Theresa, since you spoke up first, we'd like to know, what would you take? Would you take the giraffe costume to be able to go anywhere you want, or would you go ahead and be confined to the room for a year and then go free later?
Can anybody confine me anywhere? Really? For a minute? No. Giraffe costume. Come on. With my mask on and a plane. If I could get on a plane with that costume, I'm there.
How about you, Priyanki?
Giraffe all the way. There's no way I'm going to be stuck. We're all recruiters. I'm pretty sure that we all have the same answer, but I don't want to be confined in any room for any amount of time. No one can restrict me. I need to be out and about, and I will be proudly out and about with my giraffe costume, wearing a mask.
Okay. I love it. Oh, that's great. How about you, Lorraine? Are you
total extroverts? Bring on the giraffe costume.
okay?
Totally into it in all different colors, if you can, please.
Oh, nice.
So we can make a nice fashion statement there, and we'll wear it anywhere in any town in any country. We're happy to do that.
I love that. I love your attitude. That's great. Okay. So another question we have is, what has stayed the same? I would like each of you to just mention one thing, and then we'll just kind of do like a round robin kind of thing. One thing that has stayed the same. How about for you, Theresa? What has stayed the same?
In the recruitment space, or just stayed the same in the hospital, or what?
I was thinking more recruitment, but if you want to mention something else, you're fine. Whatever your one thing is.
So uniquely to just Suburban, even within the Hopkins system, actually, I think my sister hospital, Sibley, does the same thing. We all still come to work every day. So we're still in the hospital. We were off campus until July, and we were off campus for years. And then they just built out this beautiful office space for us. So we all come to work. Now, I will say there's still same level of engagement. And even at the height of the pandemic, we still would have people come in for interviews, but we would meet them in a socially distant space and nobody was going to the unit. So we tried to maintain a sense of normalcy that way.
Interesting.
Yeah. So, I mean, if you, like when people were like, oh, do I have to come to the hospital? It's like, well, you're applying for a job here and you would actually have to show up here. So yes, you'd have to come for the interview here if it's possible. If you're local, you would come. And if not, we would do Zoom. We've been doing that for years anyway. So I just thought that was interesting that we all still come to work every day.
Okay.
I might have my recruiters alternate sometimes because of childcare type stuff, but outside of that, we're all here every day. So that part still feels pretty good to me that we're all here every day to support our employees.
Very good. Well, by the way, Joanne says I'd be confined to any room, but with unlimited supply of coffee. Laugh out loud. Are you guys coffee drinkers? Yes, you're shaking your head. What's your favorite coffee? Your favorite absolute coffee?
Mine?
Yeah. Anyone who wants to speak up.
Okay. Every morning, you're gonna laugh at me. Every morning, I'm like a snooze. I'm not eating coffee. Every morning, I go to a Dunkin' Donuts down the street from me. Remember, I live in Boston, where sometimes, like in the winters, we can get well over a foot of snow. But I will absolutely get up. I will absolutely get ready and go and get my Dunkin' Donuts every morning, even though I work from home every morning. And I don't get a coffee from Dunkin' Donuts because I don't like the coffee there. I get myself a medium hot caramel latte with almond milk and an extra shot of espresso.
Oh, wow.
So my caramel latte has anywhere from 3 to 4 shots of espresso plus a ton of caramel and the almond milk. So there's tons of sugar and tons of espresso in my morning coffee. It's amazing.
Wow. Like a guy I used to work with, he would say, you are wired for sound once you have that.
That feels like a meal. Wow.
Man.
It's so heavy. Yeah, I don't have breakfast. Like, it's so heavy.
Yeah.
It's like big. So it gets me easily into like the afternoon. So that is my breakfast.
Okay, well, we got a couple of comments came in here. Brian says, my daughter and her husband are travelers. They totally understand that the opportunity to earn those high travel rates is a once-in-a-lifetime opportunity. They have paid off their student debt and are saving for a house. Do the panelists feel that there will be a huge need for OR nurses in the second half of 2021 due to the delay of elective procedures and pent-up demand? You want to take that one, Jaime? What do you think?
Well, I think that we have a huge need for OR nurses because we're opening up a new facility in Summit County, a new surgery center. I would anticipate, though, that once we flip the switch to get everyone in, we have continued to steadily see a lot of patients, and it hasn't stopped. So I don't know. I think geographically, everyone has felt differently. So I'd be interested to hear what some other people would say. But for us, it's once we flip the switch back on, it hasn't stopped. We're busy.
I think from the OR perspective, from a staffing perspective, and this is probably nationwide, like inpatient procedures, the volumes, yes, to whoever was asking that question, the inpatient volumes will increase. So many people have been limping around on that knee that needs to be replaced, hip replacement. People are even putting off, the data and statistics around the morbidity that is non-COVID related, that has happened as a result of the pandemic, and for the last year, people not wanting to go to the emergency department and would instead end up with an event that ended up being a fentanyl event. The morbidity has just been bad because people were afraid to come in, and they ignored the symptoms. So then you've got people that are even more sick, right? So, but the volumes are increasing, and I think that we've managed to maintain our OR staff. Thankfully, we redeployed everybody. Like in the first 4 months of the pandemic last year, we had surgical techs that were working as CNAs and patient care techs. PACU nurses that became ICU nurses again. So we really did a good job of redeploying. But now the volumes are finally starting to trickle back up again. But to that person's point, yes, I think we'll see the need for OR nurses. And the other thing I think that we didn't talk about was that really some people, it's kind of this point in their career where this pandemic has said, you know what, I'm too old for this. Like people are retiring now.
Yeah, I've heard that too.
When we had our recession in 2006, 7, and 8, people were going back to work, supporting spouses or what have you from the healthcare perspective. But now people are of that age, they're like, you know what? It is not worth it. I am done. And we saw a lot of retirements last summer.
Yep. I can see that. And what you said earlier about the cases also, I've heard that quite a bit throughout the country as well, that people were just putting off going to the hospital because they're scared of getting COVID on top of whatever the other issue they were trying to fix. So it's definitely real. In fact, here's how happy I would be though, if let's say these OR nurses that are Brian's, I think he said it was his daughter and her husband, if they were able to link up with one of you guys, I would feel like this right here. That's how I would feel. That'd be amazing. That'd be awesome. Because it's kind of a community we're building here, right? We're all kind of connecting with each other, and you never know what's going to happen, out of this.
Just be warned, fair warning, from a traveler's perspective, our marching orders are to get rid of the travelers right now. So,
yeah. He didn't say travelers though.
What's that?
He didn't say travelers. He said they did He said they did travelers and paid off all their debt, right? Okay, so they may be ready to actually find a home.
That'd be great. We love people that want to find a home.
All right. So Dr. Nina Nejma says, I'm a Canadian who was educated in Canada, but recently moved to Jacksonville to be near my son, who is a medical resident there. I don't need an employer with a sponsorship, however. I'm having enormous challenges getting an interview for a senior or C-suite position. I would appreciate your guidance. Hey, so we have an opportunity to give her some advice. What advice would you give her? She doesn't need sponsorship. She's looking for an executive position. I'm assuming she has executive experience. What advice would you give her? Who wants to volunteer to give her some advice? Give her some advice. Okay, Priyanki, go ahead.
Yeah, so for her, I would advise her that she needs to obviously research the company. And the best way to do it, thank God for like the world being at our fingertips, but do some research through internet, like as to who the executives are. Obviously, you have LinkedIn. So always just look at that company page via LinkedIn, look at all their employees and see who their employees are, who their executives are. and see if you can get an internal connection through their executives and through other people at that organization. So do it that way. And then also, obviously, just Google them, like look up who these people are, or like who that company is. See if it has any affiliate companies, or see if it's backed up by like a private equity firm or whatever it is. So do some research, try to spend a little bit more time. And that way, once you actually find out who's who, reach out to these people and let them know your interest level.
I like that. I like that a lot. In fact, I'm gonna go ahead,
There's
Theresa.
also the Ladders is a site that is basically used to post and to apply or to connect people that are interested in jobs that basically are, they call it the Ladders, is basically for C-suite. So it's $100,000 or more a year, kind of in that salary is the types of positions that you would look at for posting those types of jobs. And the other thing too is maybe looking at somebody like I think B.E. Smith, which is now part of AMN Healthcare, where people do interim leadership roles. So sometimes if you connect yourself with an interim role as a C-suite member, those can play out into a full-time position and take it from there. But B.E. Smith has always had a great reputation in the community, and they are now officially, I think, for the last few years, part of AMN Healthcare. So.
Yeah, that's good too. I like it. And just to piggyback on what Priyanki was saying too, Dr. Nejma, on LinkedIn, is once you find those people that you want to connect with and be with, one of the things you can do if they're active on LinkedIn is if they're posting something, interact with those posts, whether you're liking and engaging with it, especially if it's something that you kind of vibe with, you like it as well. That will definitely get their attention, especially if they don't get a ton of comments already. They definitely will see what you're putting. And then if your profile is totally up to date, and you got the pictures going, and you got the experiences looking good, you got the about sections filled out, you're talking about all the amazing things you've done, you got it bullet pointed out what you did for these past companies. It's very clear. Whenever they see you comment on their stuff, they go look at your profile. It's like, oh, Dr. Nezra, oh, she's done this, oh, she's done that, oh, she's done this, she's worked here. Oh, wow, great. And it might give you more visibility that way too. So hopefully some of that will help. All right, we got some more stuff coming in. Oh, Leah says, Dr. Nina, also make it very clear in your CV or resume that you don't need employer sponsorship. This is often a hang up for a lot of HR departments. So that's a good point, Leah. Leah's part of our own. Awesome. Okay, and Reem says, lovely to see you all. We'll love it to have you here, Reem. Glad you're here. And Gwen says B.E. Smith is awesome. So she agrees with you, Theresa. Okay. I have I'm going to get back into a serious question, but I have another question for you. Who wants to be my my volunteer to take this one?
I'll volunteer.
Okay, good. All right, good. Okay, Lorraine's going to do it. Okay, great. Oh, by the way, Dr. Nejma says, huh?
I said, back me up, Theresa.
Okay. Dr. Nejma says, amazing advice. Thanks. Okay. So I'm gonna ask. I'm gonna also let you answer another question for me when I do this question first, and that's going to be what changes you think still need to be made. So I want all of you to be thinking about that. What changes still need to be made? But before that, I would like to know, especially since you're in Colorado, I want you to answer this question. Never have I ever, and I want you to answer truthfully. Never have I ever worn sandals in the snow. So I don't want you to answer right off. We're going to guess if you've ever worn sandals in the snow. Folks in the comments, I want you to guess. Do you think that Lorraine has ever worn sandals in the snow? Let me know in the comments. And then also tell me if you've ever worn sandals in the snow. So you can say, no, she hasn't, or yes, she has. And yes, I have. I know I haven't. So please do that in the comments. Now, I'm just curious though, really quickly, Jamie, what do you think? Do you think that she has ever worn sandals in the snow?
I think possibly, yes.
Okay, she's going to go with yes. Okay.
I know I've gone to warmer weather and come back here and there's snow. So, yes.
Have you ever worn sandals in the snow?
Yes. Not on purpose.
Priyanki,
weather changes here very frequently.
How about you, Priyanki? Have you ever worn sandals in the snow?
Yes. I live in Boston. It snows here all the time. And sometimes when a girl wants to go out and look decent, like, it is what it is.
Okay. Do you think Lorraine has?
I think Lorraine has. She looks like she's worn sandals.
Okay. Theresa, have you ever worn sandals in the snow, and do you think Lorraine has?
Oh, absolutely. I lived in Maine for many years. So yes, sandals in the snow. And I know Lorraine, she probably has worn sandals snowboarding.
Okay. All right. So we're all in suspense. So what's the answer? Never have I ever, have you or have you never worn sandals in the snow?
I have, and like Jaime mentioned, not intentionally. You can be in one place in summer gear, sandals, and then you can walk out and it's snowing. So it was. I think the first time was at a wedding, and the wedding was in mid-May, and I went out in a nice summer dress and sandals, and we went through the reception and whatever. And when we came out, it was full on snow. So there's nothing you can do except for walk through the snow in your sandals.
Right. You know what? That's how life throws a little curveball. We just roll with it, right? Just go with it.
You do.
Okay. So Lorraine, what changes do you think still need to be made when it comes to recruiting?
Well, first of all, on volume, and you can think of all the different recruiting strategies out there that leadership want to put in place, etc. But when you get this increased spike almost overnight, and folks say, hey, you know what? Regular sort of rec loads are supposed to be around 45 and you're managing 160 or something. It's intense. So I think
yes.
I think it's just getting a good handle on that, and it's almost like one curveball after another. You're already sort of busy ticking along, and then the pandemic hit and everything came to a grinding halt, and then we were pausing some of the recruiting efforts, and then we were looking at different service lines in different areas and where we needed to spike up or where we needed to increase. And then the floodgates started to open again. It's like, now we need more people, so let's bring in more people. I mean, we're in the process of bringing in more folks to help us in talent acquisition and more contractors, but you still have to go through that learning curve with them as well. So it's like, well, I'm already busy, and now I'm going to start to train somebody as well. I don't know where that happy medium comes, but I've been doing this a long time, so I haven't seen it in the last 25 years. So some of the things that need to change moving forward, yeah, probably that.
Okay, that's a good one. That was an excellent one. Okay, so let's see who wants to go next. So what do you think needs to still change? I'm sorry. What do you think still needs to change? What do you think, Theresa? What do you got for me?
Well, I think from a re-recruitment and candidate perspective, I think that we don't often, globally, have the easy button for them to easily say, I'm interested.
Right.
I want to talk about this job. I think that, we have so many layers, right? In the application process, no matter how much you try to shorten it up. And if you work, I feel like the bigger the institution, the more the grind it is, right? So it's like we want more and more information on the front end. And I feel like we need to have an easy button for the candidates to just say, I'm interested, and go from there. The other thing I think that we need to focus on is really something that I've been very passionate about over the years is how do you have high touch with candidates by using technology, right? So the videos, right? Videos are a fantastic way to personalize something where you can greet somebody and say hello to them, but you're not there in front of them. They're literally receiving a text or an email from you, and they're clicking into a link, and all of a sudden they see your face like, hey, nice to meet you. I've been doing that for years. And when people come up and used to hug me, now we just elbow bump. When people come in and they're like, oh my God, Theresa, I know you. And I'm like, hey, like, I know you. but they remember you. And it's because you've added these layers of personal communication.
I love it.
I feel like as I'm trying to capture personally, I need to hire ICU nurses, right? That, people either left because of childcare, like Priyanka was talking about, or people left for travel assignments. Like, I need to get them back, or I need to hire nurses. And I'm not going to have the competitive wage from a travel agency, that's going to offer. So what can I offer them? And it's the product that is my hospital. And it's that personal touch. And we always call it the Suburban hospital family. But how do you communicate that to candidates, right? So high touch.
I like that. You know what? I'm going to check with the audience to make sure they like it too. Just what I thought. They liked it too. I love it. Those are great points. the rec sizes. I love the points about the personal touch. That was amazing. And I was getting a little emotional when you started talking about videos because that's my jam. Anyway, okay, so what are your thoughts? Either Jaime or Priyanki. Jaime, what do you think? What should still change?
Oh, because of all my work with you, I realized that what needs to change is like more focus on a recruitment brand. And we talked about this earlier, but I think I am really struggling with what the future holds as far as career events. Like I like to get in front of people. I want to hug them. I like to interact with them. And everything now is virtually. That is a challenge and a struggle for me because I'm sure like all of you, I'm a people person and I thrive off other people's energies. And I worry what that future looks like for career events and just all the conferences and stuff. And so I'm concerned about that. And I'm trying to embrace developing a recruitment brand and I long for the day of getting back into a room with everyone.
Yeah, absolutely. Okay. So Priyanka, I want to get your thoughts, but before you answer that, I want to see if you want to take this question instead. It's up to you. So Brian Hudson from Florida, he says, have your training and onboarding practices changed due to COVID and the shortage challenges? What will be the gap to get those new grads? So I know he's talking about new grad nurses, but I know you also do new grad dentists as well, same principle. So you want to take that, or do you want to take what else still needs to change?
Yeah, I'll take both. So
okay.
let's start with Brian's question.
Cake and eat it too.
Absolutely. So our onboarding has definitely changed. I'm sure it's the same for everyone here. We're now doing all virtual onboarding. So the way that we've changed our interviews, we're doing all virtual interviews. We're doing virtual onboarding as well. Again, in the beginning, it was kind of nerve-wracking, but it's been going okay. We're doing pretty fine with that stuff. I mean, I'm sure that everyone here agrees with me as well. The way that you feel energy when you're in person, it's definitely not the same thing. But I'm not complaining. The video thing is still, it's starting to become my jam. It wasn't my jam before, but it's starting to become my jam. I'm starting to deal with that, so that's good. But so that's that. That's how we change our onboarding. So nothing is done in person. Everything is done virtually. And in fact, if we hire someone in our corporate office, we literally mail out the laptop and stuff that they need. So essentially, everything is pretty much done completely remotely, completely touch-free. So that's been actually pretty nice. But I agree with what Jaime was saying. Us recruiters, we're very outgoing. We're people come in and give me hugs after they get hired. You're Priyanki, oh my gosh. I don't get that anymore. So I personally miss that. But also same thing, we've been doing a lot of these virtual career fairs. So even when you hire a new grad nurse, or if you're hiring a new grad dentist, we used to be part of the dental schools, or you're part of the nursing schools and you're going to do their career fairs, or you're going to do a lunch and learn, or you're going to do this. And now everything is done virtually. But the thing is, no matter what happens, you don't get as many people even coming through the door. I think everyone who's in nursing school, everyone who's in dental school, the feedback that I've gotten is they're completely zoomed out.
Yeah.
All their sessions are done through Zoom. So they're already exhausted. So now us coming out, trying to do these extracurricular things, at one point, though they appreciated, they would come in and try to get the free lunch or whatever the case was. They're done. They're done. They don't want to come to these things. If they come, they're not even engaged. Their Zoom cameras off. So, if they're on there, they're literally probably just not even paying attention to you. And rightfully so. I'm not even upset about it.
Right.
I get it. I put myself into their shoes and it's exhausting. So, and I feel for us as employers, I spent so much money this past year. So it's not all these companies reduce their costs. So the cost of doing the career fair was the same exact cost that it always was. So I'm spending all this money, yet I'm getting probably not even 1%, nothing. I'm getting nothing. I recently was part of a career fair for a dental school here locally, and we spent the same amount of money, and literally I got 0 people, 0.
Wow.
And we're a very nice, well-known organization here. where when we're there in person, I have so many people coming to my booth, and here I got nothing. And that's because I'm a firm believer that these things need to be in person. So no matter what happens, that does need to change. As we get, I want to be back there in person. It needs to happen.
Yeah, I think there's a lot of folks that agree with you. I'm not really sure. But let me just check. Yep, they're in definite agreement with you. We're looking forward to the in person for sure. Okay, I have another question for you. Who hasn't answered recently? Because I want to make sure I spread the love here. Who hasn't answered the funny questions recently? Who hasn't done one yet? No one's volunteering.
I'll do a funny one.
Okay, Priyanki. All right. So let's do this here. Would you rather ride in a tight crate for a 13-hour plane flight or cows in the back of a truck for a 2-day road trek? Which one would you take? And those are the comments. I want you to answer to the comments. Answer, please. Go ahead.
You want me to answer?
Yes. Yes. This is for you, Priyanki.
Okay.
Yes.
Tight flight. No brainer. Get it done with.
Get it done. Yes. Or in the words of there's a philosopher, he uses the term, he says, get her done. You ever heard that before? Larry the Cable Guy?
But are they milking cows? Can you have milk?
Well, you can frame the question however you want. Let me get it again. You can either ride on a tight crate for a
drink almond milk.
Yeah, so you can either ride on a tight crate for a 13-hour plane flight or cows in the back of a truck for a 2-day road trek. So one's 2 days and the other one's just 13 hours. So Priyanki says she's going to take the flight. What would you take, Theresa?
I don't know. I think it might be kind of fun depending upon where I'm going with the cows for a couple of days. And if they're milking cows and I could have something to drink, I'd be okay.
That's true. And if you could have cookies and ice cream. If you have some cookies, you can have.
That's all right.
Or cookies and milk. Sorry, not ice cream.
I'm not in the back end of the vehicle.
And those are the comments. I want to see what you guys will do. Oh, so Brian says, I agree. He says, get it done. Fly happy. So he's going to take the flight. Okay. So one of the other questions I had for us is, what are your expectations of hiring managers or candidates? I'm sorry. Let me rephrase that. What are the expectations of hiring managers and candidates in 2021? And how is that different from previously? So how have their expectations changed, would you say? Who would like to answer that first?
I'll jump into that.
Go ahead, Theresa.
The sticker shock, or especially if it's like respiratory therapy or ICU, where people, or even mental health professionals, if somebody has deployed someplace else, AKA they took a travel assignment, and now they're looking for their next home. And I am not saying that's a bad thing, mind you, to all the people that are out there. I get it. I mean, we've lost people here, and their stories make me cry. Like they've got like 3 members of their family who have all lost their job because they were in the hospitality industry, and they're the breadwinner for what was 4 incomes and it's now 1, in like multi-generational family homes, and it's one person. So if you could make $35 an hour or go make $95 an hour, you're going to go make $95 an hour. That's a Maslow's hierarchy of needs, food, water, shelter thing. It's a no-brainer.
Yeah.
But coming off of those travel assignments, they have to remember that it's not a travel assignment anymore.
Right.
It's hard, right? And I think that that's going to be hard for people. Like I've had people that, they're like, well, do you have any travel assignments there? I'm like, well, you applied for a regular position, or I found you and we talked about a regular position, not a travel position. So you get addicted to that money, that income.
Yeah.
And that's going to be hard.
That's a good one. Yeah.
Yeah.
Any others?
Yeah, I would agree with what Theresa says. I mean, it's a shift in the candidate motivators. They're playing one company off against another company. They're asking for everything. They want a sign on. They want a retention bonus. They want a commuting stipend. They want a puppy. I mean, they literally run everything. So, we are pulling out all the stops to really try and entice these candidates, but it really is a buyer's market. They might have one or two other offers on the table, and they're just playing with the recruiters to see where they will best fit and land, and really how much they can get really out of the company and out of you. They know there's a crisis.
Yeah. And you can't blame them. I mean, it's their fiduciary responsibility to get the most they can for the time they spend. But at the same time, it's kind of hard to juggle that with your fiduciary responsibility, which is to fill the job at a reasonable price.
I like to warn people that if they're, especially new grads, doesn't matter what role you're in, if somebody's throwing the sun and the moon at you, and it seems just so amazing and so much better. And then I tell them, I give them advice. Ask the following questions, like senior leadership turnover. How many managers have been in that role? And you can't ask the question, how many travelers are on staff, but you can ask about turnover before the pandemic. You can ask about, there's a hospital down the street in the district that, they've probably had 5 or 6 CNOs in about the last 10 years. That's not good. And, they can't keep managers there. And so, as a new grad, and they're going to pay off my loans, and they're going to give me this, and they're going to give me that. And it's like, that will come with a cost. And if it's your license that's on the line, are you willing to pay that cost? Or I'll see you in a year or two.
That is like the comeback of the day right there. Wow, that was powerful. Very good. Okay. So we're almost, I cannot believe this time has passed. We're almost in with the time. So Jaime, you have something you want to quickly put in, or Priyanki, do you have any thought in terms of expectations, maybe of hiring managers? Go ahead.
Yeah, I think, the candidate expectations are high and we're competing. The hiring managers, I think, are looking at how do you grow your people? How do we do career ladders internally so we can, keep them engaged? And I really think another expectation is that recruitment is going to keep the business accountable for your diversity efforts. Those are all things that what's happening for me.
Yeah, absolutely. Priyanki?
So I agree with what you guys are saying. Just so you understand, in the dental industry, pre-pandemic, it's always been a huge shortage, and I'm sure it's the same thing for nursing as well. Pre-pandemic, there was a shortage. Now, post-pandemic or during pandemic, the shortage is more real than it ever has been. And same thing, what our candidates are doing is they're playing off of one of each offer. So they're saying, I'm getting an X amount of sign-on bonus here. Are you going to be able to give me more? Literally, it's almost borderline unprofessional conversations that we're having. I've never had such uncomfortable conversations ever, but I'm at a point where I draw the line. I'm like, this is what we can offer.
Right.
We are a great organization. I know this for a fact. Here's what we can do. And this is what we can do. And we're really excited to bring you on board. But having said that, the decision is yours. So if you feel like in the end, you really want to go for that company that does have the huge amount of turnover or does have this, then please have at it. And I guarantee I'll probably see you in a year and we'll connect after a year.
Ooh, okay. So
yeah.
Money, right? If it's about money, it might not be the best fit.
Yeah. And I agree with what Theresa's saying. I always tell my candidates, I understand that you're getting X amount of dollars, and I'm sorry that we just won't be able to do it for you, but make sure you go back and ask these questions. Make sure you truly do your research. So when something looks so glamorous from the outside, it can't be that glamorous on the inside.
That is very good.
I want the puppy.
Yeah. Okay. You guys have been amazing today. Really one really fast one. What's your favorite sound in nature? Really fast. 5 seconds
Birds
away.
singing.
Chirping.
Birds singing.
Birds.
Ah, birds. Okay. Teresa? White water. Nice.
Yeah.
Well, very good. Well, thank you. You guys were amazing today. Those in the comments, let us know what resonated with you because we got them all tagged in. They're going to see your comments. Let us know what you enjoyed about the discussion today. I certainly enjoyed it. I learned a lot. All of you ladies are amazing. We appreciate what you're doing for healthcare and for the recruitment industry, giving us recruiters a good name. I love it. So keep doing that. Let's go ahead and say bye to everyone. Bye, everyone.
Bye, everyone.
Bye. Okay, for Sam, for just
now.
a second, I got a little bit of delay here. 1 second. I want to make sure I don't cut us off while we're still on the air. I've done that before. So let's see here. All right. So, Jonathan, let me know when I'm safe to hit the end button.
You're good now, Rollis.
All right. Thank you.